Have you been feeling anxious or stressed more than usual? And how about sad or frustrated or even angry? If you answered yes to any of those, then this is the episode especially for you. In this episode, we will focus on mental health and how to cope after COVID-19. And just to give you a little bit of context, at the time of this recording, major cities all across the United States are reopening after the coronavirus. And we are also in the middle of the week of the George Floyd protest. Dear ProFAITHsional, this is a podcast to share God's favor over your work life while I offer you a professional favor. Although faith without works is dead, sometimes we do our job and work without faith. So my wish is to inspire, motivate, and encourage us to grow our faith in the midst of our job and work environment. Thanks for listening. So today I'm sitting with Maricel Garcia, my sister, who I am calling the secret weapon to this podcast because she is a mental health specialist. And so I really rely on her to kind of do consulting for me in terms of how do we manage these kind of deep topics and to make sure that we are walking with mental health. So Maricel, tell us, welcome on the podcast.
Hi, everyone.
So how would you describe what you do?
So I am a licensed counselor. Currently, I work as a therapist at a health center.
All right. And on a day-to-day basis, what are some of the patients or what are some of the challenges that you're faced with?
So since I work at a health center as a therapist, the idea is that a lot of times people's first stop whenever they're dealing with mental health issues tends to be their doctor's office. So my job is to offer interventions for people dealing with typical issues like anxiety, depression, or just general stress issues.
Now, is it typical for someone to come into the office describing symptoms to their primary doctor, such as maybe, I don't know, something physical, but then when you come in and you start kind of going in the conversation with them, you figure out, hold on, we're not talking about something physical, we're talking about something mental health related.
Yes, because the way my health center is organized is I'm not the first person that this patient will speak with. Usually the appointment is with the doctors, and after they see any kind of need for me to go in and speak to any patient, then that's when I come in. So a lot of times, a lot of these mental health issues start off as physical issues. So a lot of times people will go visit the doctor, and then whenever the doctor see any need for anything that I can help out, then that's when I am called in to see the patient.
And what are some of the physical kind of symptoms that patients typically describe?
Anything from lack of appetite, trouble sleeping, or sleeping too much. Those tend to be the typical things. Or on the other end of things too, I can talk with patients about if they're struggling to manage their health, especially when they have more of chronic conditions, then I can just talk with that patient and kind of discuss with them what are some of the barriers keeping you from managing your health. Because at the end of the day, the mind and the body are very connected.
All right. And so that we can say maybe that's on a normal circumstances. Under normal circumstances, someone will come in and express some of those things. Now we are having to cope with COVID-19. And so how has that kind of maybe changed the dynamic of patients a little bit? Like when they come in, how are anxiety levels? What have you observed?
So for patients who already have some of these issues, being depression or anxiety, and really any other kind of mental health issue, this being quarantine situation and also the virus at itself, the uncertainty, this has brought people's symptoms to resurface, even in a situation where maybe they were fine and a lot of their symptoms were managed, maybe self-managed, or even managed with medication. They were managed somehow, but then now with this added stressor, then people's surfaces have resurfaced. or a lot of people who maybe have never dealt with any of these issues, mainly more so anxiety and depression, then they're starting to deal with some of this.
Now, would you say there's a difference between the people that maybe have been essential workers versus people that maybe have been having to cope at home while they were not considered essential employees?
I feel like everybody is stressed out, honestly. For some people that are having to go work, they feel scared, uncertain, nervous, anxious, just knowing that they're having to go out in the world and deal with people. And then for people who are at home, just not knowing how to manage all this time, and then a lot of ways maybe that you will use to cope with some of these feelings, you can't do. You can't really go out and visit many people. Restaurants are a lot of, now they're opening back up, but for the most part, everything was closed. So you're pretty much stuck in the house. And what I was finding too is that some people were taking things a little bit too literal, I would say. And I would have to have these conversations with people at times, because the idea is to keep safe, especially with the social distancing, is to keep safe. It doesn't mean you can't go outside and go for a walk or do things like that. It just means you have to distance yourself from other people. And I was finding that a lot of people, especially people who already have some anxiety going on, or some kind of depression or something like that, they were so scared that they weren't even leaving the house.
Mm.
And that is not good for your mental health either.
So, for the person maybe that has been mostly at home and now they're having to look at ways to reintegrate themselves into work and those sort of things, what are some of the ways that you're advising people now that we're having to go back into a new normal?
Yeah, it's scary for people. So when working as a therapist, when working with people, you always want to bring attention to people, the things that they have control over. Because when we have situations that are uncertain, that we have no control over, that adds to our anxieties. So it's about brainstorming with that person and figuring out what are the things that you have control over. So for a lot of us, we have to make a living. We have to return to work. So taking measures that will help you feel comfortable being in that environment. So if that means carrying around your hand sanitizer, washing your hands, those things that we know and we keep being bombarded with having to do, and a whole bunch of reminders. Definitely making sure that you do that, but also doing things like, if you need to take a break, if you're capable of doing that when you're at work, step outside, take a few deep breaths, get yourself together, trying to focus too on those kinds of things. Because a lot of times people don't really think about self-care and the importance of self-care, but that's an important aspect of health. And when I say self-care, it's just prioritizing your health, both physically and mentally.
Okay. So we know that we're having to cope with some of that lack of control just because there are so many unknowns, and now there's things that we're having to do that we didn't have to do before. So that's a stressor too, right? I mean, just to be honest and transparent, when I found out that I had to go back to work, I was hysterical just because I'm working with very close proximity with teachers and parents and children. I'm working at a child care center at the moment, and so it's impossible to social distance. So it's like it's not the fear of getting the disease, but it's managing, making sure that we're going to be doing the temperature checks at all times, making sure that everybody's washing their hands at the designated times, that we have new protocols to do with everything. So all of those stressors now that are having to be imposed on people that are going back to work, when at the same time they've had to maybe deal with all of these unknown, and what if someone around me has the disease, and how can that potentially affect everyone around us? So in those type of situations, have you encountered anybody and you've had to help them kind of work through kind of a plan for them?
Yeah, like I was saying earlier, I've dealt with people who just refuse to leave the house. So, what does that mean? If you live alone and you can't leave the house, how are you getting groceries? How are you getting the things that you need? If that person doesn't work, I mean, you have that luxury of staying home, but you still need things. And like I was saying earlier, again, still not good for your mental health. At a basic level, I tell people sometimes, like, hey, if you don't feel comfortable walking around and going for a walk because you have that much anxiety, at least sit outside, get some sunlight. I mean, that will do a little bit of good versus you sitting at home with your thoughts, worrying about things and worrying about a lot of these uncertainties.
Now, what about when people want to inform themselves with just maybe watching the news or just being like just really consuming all of this media and all of this information? How have you had to advise people and what sort of recommendations have you been giving them?
So, for a lot of people, especially if you're someone who already are an anxious person and already deal with a lot of anxiety, just on a daily basis, limiting whatever media, news, social media, all of that, because at the end of the day, that's going to add more to a lot of that fear, a lot of that uncertainty. And as we know, a lot of times the news is very one sided. So we hear a lot about the number of deaths and the number of deaths. And that's what the news mainly focuses on. They don't focus on the people who maybe as much. Sometimes you do see those stories. They don't focus on those things. So it's important to limit those things, especially if you already know yourself and know that you deal with those things. I know coworkers that have told me like they've gotten off of social media altogether because we're having to work day in and day out. And where I work, they do these COVID-19 tests and all of that. So I know people who just have gotten off of social media altogether, stopped watching the news altogether for the time being, just because they know that at the end of the day, that was better for their mental health.
That's good. I think that's something that all of us can use at times, and we have to be conscious enough on how to manage that for ourselves. So, something else that I would like to maybe touch upon and hear from you is about maybe the grieving process, right? Now, post COVID-19, we know that a lot of people have either lost a loved one, someone close to them, or maybe they even know someone that lost their life to the virus. Now, what are some of the things that we can advise or we can share in those sort of situations?
So first off, my heart goes out to these people because I myself have talked to patients who have lost some kind of family member, whether it's someone, a close family member or a friend or whatever it may be. And it's a very sad situation because a lot of times with all of this that is going on with the virus, you can't even have a proper burial for that person. We can't get together. We can't celebrate that person's life. So it's a hard situation to deal with. But I would say give yourself some time to deal with those emotions because a lot of times we don't like feeling these negative emotions. But when you deal with a situation like that, it's a normal response. And whatever the emotion is, because sometimes when people lose a person or any kind of loss, it may be anger. It's not always just sadness, but give yourself some time to grieve, to feel your emotions. Talk with someone. Don't just stay with all those emotions bottled up inside either. That's not good, not healthy. And if you don't have a safe space to maybe discuss some of these issues, I always tell people journal. That's always a good way to express and get some of these feelings out. Or consider seeing a therapist when you're ready. Because in the mix of things, maybe it might take you a little bit of time to feel ready and feel like you can get some of these feelings out. But the most important thing is to give yourself some time and then eventually get some of these feelings out.
Now, grieving is an interesting process because I feel you don't have to have lost someone that you knew directly in order to grieve. what would you say? Because, there's always a temptation for someone to say, oh, well, just, I mean, get over it. It's almost like you didn't know the person or you weren't related. It's like the newspaper that put out the 100,000 names out in the front, cover, just acknowledging the loss of life. So maybe I don't know one of these people, but what would you say to someone that maybe is going through the sadness of it all, or maybe even the anger, or any of the emotions in the array of the grieving process?
I would say it would be very similar. Just giving yourself some time, and to feel the emotions, but also to get these emotions out and just talk to someone. Because a lot of times we feel like we're alone in this situation, but with the pandemic, we're all dealing with it some way. It's hit all of us. No one is exempt from dealing with the pandemic.
And then there's also with the loss of life, maybe what about the people that are grieving, their lives have changed. Maybe it wasn't a loss of life, but their life now, as they knew it before, it's completely different. They might have lost a job because of the coronavirus and the quarantine and some of the financial stressors on different companies and organizations. What are some of the recommendations for people that might be feeling, that loss?
In therapy, we deal with giving people back their control. So I would say in those situations, what are the things that you can do that are in your control? So, for example, if you lost your job, well, now you have a little bit more time on your hand. So start looking for things, put an ear out. Now you can't go very many places, but at least start searching for things online. Start building your resume, taking baby steps to reach you to your ultimate goal. A lot of times when we think of a big goal, that's overwhelming to us. And sometimes it seems so far away. But if each day or each week you take little steps to get you closer to that goal, you feel a sense of accomplishment that's going to help build your self esteem and is going to give you that sense of control again.
That's good. So it sounds like in any sort of wherever we may be in this process, we need to focus on the things that we can do. What are the things where I can maybe, put my energy into and see a little bit of results, right? It doesn't matter how big or small the result may be, just to give us just a little sense of control. Is that what I'm hearing?
Right.
And then also, what about, I know there's an emotion that maybe we don't, we see it in the news a lot, but we don't really talk about how to either, cope with it, manage it, or channel it. Anger. How do we deal with anger, right? Some people may be angry because they've lost the job. Some people may be angry because of they've seen how, COVID has disproportionately affected different communities, right? So there could be an underlying sentiment of just anger and frustration. How do you advise someone in those circumstances?
And I would just say it's okay to feel that way. And in many cases, it's normal that you would feel that way. But acknowledge that emotion. A lot of times I'll educate people and tell them that emotions aren't bad. Everybody at one point or another, we're going to feel an array of emotions, and emotions itself aren't bad, and all emotions that we feel serve a purpose. The easiest emotion to think about it a lot of times is fear. A lot of times when you feel scared, it's your way, that response is your way of your body protecting you. So when you're in that situation, either you're going to run or you're going to freeze, but you're going to do something. So with all of these emotions, there's a purpose there. So, what I often tell people is that educating that it's okay to feel these emotions. Now, what gets us in trouble is what we do with those emotions. So, the emotion itself is not a bad thing. But if you're a person that you're angry and now you put all that anger on someone else who has nothing to do with the situation, then that's not right. So, the emotion itself is okay, but learning how to channel it. So for each person, that might look a little bit different. So, like I was saying earlier, if you're someone who likes to write and you like to journal, get out your pen and pencil or your laptop, write out what is going on, what are you feeling. Make a plan if you're a planner. I know for myself, I usually like a plan, and that gives me, again, that sense of control and helps me feel a little bit more hopeful. So if you're that person, sit down. What can you do about this? What are some steps that you can take yourself? So just channeling that emotion in a more positive way.
That's good. That's good. Thank you for acknowledging that. I believe that people hearing this, if anybody has been feeling that way, please know that, like as Maricel said, it's okay. It's okay. It's now what do you do afterwards? Now you've mentioned a couple of times about maybe talking to someone and expressing. When would you say is a good time? When should the person decide on, okay, I need to talk to someone now? When should they take that step?
So when I say talk to someone, sometimes that can mean talking to a friend, talking to a pastor, talking to a close family member, someone that you trust. Sometimes that can be helpful within itself. But when you're finding that that's not enough, or when you feel like you're really stuck and you can't find a way out of these emotions and you're struggling to cope, then maybe that's when it's time to take that step to talk to someone more on a professional level, being a therapist or counselor or whatever you would like to call it. That's when maybe it will be time to consider that.
Okay, that's good. And what about if I'm watching maybe from a distance? Maybe it's someone that I care about, a loved one, a family member, maybe a friend, a good friend, or a friend of a friend. If I see someone, how can I best be of service to that person? Obviously, I'm no therapist, I am no certified counselor, but how can I? What is one of the better ways that I can help someone that may be going through some of that, or even encourage them to seek out help?
So I would say just being a good ear. At the end of the day, I believe that people, we just want to be heard. To at a basic level, sometimes, not always, but a lot of times, we know what we need to do, and you probably have your mind made up on what you're going to do. Um, or sometimes you just want some feedback from other people. But I think a lot can be said by just being a good listener. But as people, sometimes we go straight into problem solving, and sometimes that can do more damage than good. So I feel like just being a good listener. Now, if it's different, if that person is asking you directly for feedback, then I feel like you're safe to give your opinion and what you want. But always start off with at least listening and being a good ear for that person.
Yeah, I can see how that can be very tempting, especially when we think that we might have some answers. So we think we know what someone should do. So
And we
thank you for that.
never really do, because you're not in that person's shoes. So even as therapists, a lot of times people think that it's my job to tell you what to do, but that's not my job. My job is to empower you, to make the best decisions for you and help you come up with those conclusions. Because at the end of the day, you're the one that has to live with those decisions you made. I go home, but you have to live with whatever you decide to do.
Now, another question I have is, so what about if I'm getting to the point that, okay, yes, I need to talk to someone. Maybe I need to speak with a professional, a licensed counselor or therapist. Now, what are some of the ways maybe that maybe I sat in somebody's share, right? And then I start to feel uneasy, like maybe this person doesn't understand me. What are some of the signs that maybe I have a good match or I don't have a good match with a therapist? Because does that matter?
Yes, I feel like being a good match is definitely important, because just like with any relationships, I feel like your personalities have to vibe. So it's very important that that person is a good match for you. And not everybody is going to be a good match to work with you. So I would say, number one, you should be in tune to how you're feeling when you're with this person. If you are feeling like it's not a good match, I always challenge people, as awkward as it may be, say something. Talk to that person, let them know, because sometimes there can be things that are going on in your subconscious that you yourself aren't aware of. So sometimes it can be good to challenge yourself. Sometimes it could be on the therapist as well. Sometimes the therapist can be triggered or have situations where that can make it not a good fit either. So sometimes just by discussing these issues, you can get past that. If it's a situation where it's just something that you can't get past, then maybe that's a situation where you need to start working with someone else. In some places, like in the past, I've worked at a mental health agency. There was an array of therapists there. So that was an easy process. And you would just get with someone new. And I often would tell people too, if you don't feel comfortable bringing up like this conversation with the actual person itself, talk to a supervisor. And just like when you go to the store and maybe you don't get good customer service or you're not happy with something, you talk to a supervisor. So you can do the same thing there if you are able to do that. Some situations, if you're seeing someone privately, you can't do that. But at the end of the day, if you're dealing with someone, if I am told that for some reason I'm not a good fit, I just want to help you out. So I will even help you find someone who is a better fit. And there's situations, like I said, where you can get past that, but then there's also situations where it's something that maybe you just can't.
That's really good. So thank you, Maricel, for helping us identify when we have a good match with a potential therapist for us. Now, in order to start winding down, is there any last advice that you would like to share with our listeners?
I would just like to highlight some of the points that we made throughout the episode, just to make sure that you are aware and in tune of your emotions and the importance of that. No emotion is bad, just how we handle it is what kind of gets us in trouble sometimes. So making sure that we're channeling those emotions in a positive way, and also practicing self-care as much as possible.
Well, thank you for that. And I would like to thank you, Maricel, for spending some time with us to give us some practical tips in order to maintain and practice mental health. And now that we're starting to move forward into a new normal, even though we don't know what this normal will be. So thank you for your time. Now, also, if you would like to keep the conversation going, and if you may have any sort of questions that you would like to post, be sure to join the private group on Facebook called ProFAITHsional Favor. You may also write to favor@jarisagarcia.com, and be sure to subscribe to the podcast in order to be notified about the next episode. Now, if you know someone who could benefit from this content specifically, be sure to share with them. I'm sure that they would appreciate it. I just want to thank you for listening, and until next time, bye-bye.